And also, let's make sure that we are recording. Thank you. All right. Again, my name is Angela Carter. Welcome. And Walter, would you please go ahead with attendance?
I will. Thank you. I want to start at the top of the list. Welcome, everyone. And our first person, Amy. Is Amy here?
Yes, I am.
Hi, Amy. Blue? Is Blue? Okay. Carlos?
Right here.
Okay. Thank you, Carlos. Caroline?
Here.
Hi, Caroline.
Hi.
Oops. Okay. Sorry about that. Dharma?
Here.
Hi, Dharma. Aowen? Henry?
Present.
Hey, Henry. Hubert? Is Hubert here? Okay. Karen?
Hello, here.
Hi, Karen. Keisha? Keisha's not here yet. Lana? Is Lana here? Okay. Leticia? Melinda? I think I see Melinda. Hi, Melinda.
I'm here.
All right. Good to see you. Morgan?
I'm here.
Hi, Morgan. Nicole? Is Nicole here? Okay. Onisha? Okay. Ron?
Hello.
Hey, Ron. Sabrina? I think I saw
Here.
Sabrina. Hi, Sabrina. Zeb? Is Zeb here?
Hello, I'm here.
All right. Hi, Zeb. And then Steve? And Dr. Richardson?
I'm Walter. I'm here. You call me Reginald.
Oh, yes, sir. Reginald. All right. Okay.
And Walter, Blue also just came into the room.
Okay. Got you. All right. You can proceed.
All right. Thank you so much. So again, this meeting, just for the purposes, is being recorded so that anyone who is not able to attend is able to watch it later. We're also live on YouTube. And if you have any issues or get knocked out of the room, please contact Jessica Carroll. Her contact info is in the invitation. We have live captioning today in English and in Spanish. And the Oversight and Accountability Council welcomes and encourages community input. Members of the public are invited to submit public comments by emailing us at oha.measure110@dhsoha.state.or.us. And if you would like to find out more information about the council, that can be found on the Measure 110 Oversight and Accountability Council website through the OHA. All right, so at this point, I will pass over to Sabrina to make any opening announcements she may have, and then we can get into today's agenda.
Good afternoon, everybody. I'm so glad to see everybody. I hope everybody had a good little time off, a little break. Today on our agenda, we have some different things we're going to talk about. We're going to talk about some updates, which are going to be around the burn and the Rfga. We're going to talk about New Year, new Zoom link. We're going to have a Measure 110 reporting presentation, and that is going to be with Christopher Mcfettridge and Sean Mcmahon. And excuse me if I slaughtered those names. We're going to talk about the media plan and application and screening updates. And I'll turn it over to you, Angela. Thank you.
Okay, thank you. Well, for starters, I wanted to say to everyone, congratulations. The rules have been posted in the Oregon Bulletin. And we have completed this particular step of the process. So just really good work to all of you. It's been such a huge push to get this done, and I commend all of you for all of your effort. Thank you so much for all of your time that you've given us the last few months. So the next step with the rules is to wait. We have a period of public comment that will be lasting until January 21st. There'll be a public hearing held on January 18th. And at that point, after the 21st, the council will be asked to consider the comments that have come in from the public and potentially integrate some. And then there will be another period of evaluation with back and forth. The DOJ will have a chance to look at it. Our rules coordinator will have a chance to look at it. There'll be some cleaning up and editing, final additions, and then in February, we will file one more time for the final filing, and then the rules will become permanent. So just wanted to give you a little bit of a walkthrough of that process so that you have a sense for what's going to happen. We're going to have a quiet period through December and most of January, and then we'll have a little bit of work at the end of January, beginning of February, to finalize the final rules. Okay, I'm sure that all of you are also excited and interested to hear about what's going on with.
Can I ask one question before we leave? I raised my hand. I don't know if anybody saw my hand being up.
I didn't see it. I'm sorry. But please go ahead.
But just in terms of the public hearing, does the council have a role in that meeting?
Well, the way that the public hearings generally work is we invite the public, they join us in a Zoom meeting, they provide their comments, we listen, and we don't provide feedback at the time. We just take their comments down, and the council is welcome to be a part. I would actually say it would be very useful to have council members there so that folks know what people are asking about and can have meaningful conversations about the comments in the OAC meetings. So I would definitely encourage.
So primarily it's going to be who rules and staff?
It will be staff and the public, and probably the rules coordinator will be there. I would say yes. And then the council would be there as well to listen to any comments that come in from the public.
Okay. Thank you.
We have Blue with their hand up.
Oh, yes.
I just wanted some clarification on where the rules can be found. I'm not familiar with the Oregon Bulletin that was mentioned.
I will drop the link for the Oregon Bulletin into the chat right now. This is the one for December of 2021. And there are a number of rules that are included, but if you scroll down to our rules number, let's see, maybe I can make it simpler. I will drop this into the chat so you can take a look. And looking for our specific set of rules. There are a number of pages, but if you scroll to the chapter 944 rules, you can open it up and you can see what is listed on the Secretary of State website. If anyone has any trouble opening that or finding it, let me know and I'll get you a more direct link as soon as I can.
And just for the sake of clarity, I just want folks to know that the DOJ and rules made some final clarity edits and comments that were presented to the tri-chairs that didn't materially or substantially alter any of the language. It just created more clarity and specified specific language. So it's just really more getting clarity on the language, and that was presented to the tri-chairs on Monday, and we were very comfortable with what they had presented, and so that's what got posted. Those final edits.
Thank you, Ron. Any other thoughts or questions on the rules? Okay. So moving then to the burn request for grant applications. We have started to receive applications at this point. We've already got a couple. And so we are forming groups to evaluate the applications. I sent out an email to the council yesterday requesting folks to email me to let me know if you are interested in being a part of an evaluation group. There is a conflict of interest form that is attached to the email. If you are interested in joining us, please fill out that conflict of interest form and send it back to me, ideally by the end of the day on Thursday, December 2nd, tomorrow. Generally, we're going to form groups of 3. Each group of 3 will evaluate a set of counties and look to create a burn for each, or burns for each of those counties. They'll evaluate independently, then come together and discuss in a group of 3. And then once the groups of 3 have made their decisions, all of the groups will meet, share their decisions, discuss any changes, and come to some final decisions. Then that will be presented to the full council the week before the final decision must be made, which is January 10th. And at that point, once it's presented to the council and the council agrees, we can move forward with providing award letters to the grantees.
Can I just push on your language just a little bit? So
please feel free, Ron.
So you said, you know, you said there were going to be groups, but what that means is there's going to be a subset of the council, and that would be the subcommittee on evaluations of the RFGA. And that subcommittee will be divided into groups. So it's only council members that are going to be involved in the evaluation process.
Correct.
So we need as much participation from members of the council as possible. So I just wanted to.
Also, I had a couple of questions, back up a little bit. I wanted to make sure that we addressed a question that I had, and maybe Cora would be the right person to answer it. Do we fill this out ahead of time before we start participating, or do we fill it out when that time arises that it might be a conflict? I'm unclear about that.
Everyone who is an evaluator will need to fill out the conflict of interest form.
Because it says on there, like, I just want to say why I'm confused is because it says on there, if it's a conflict of interest, why it's a conflict of interest, it's a potential conflict of interest, but how are we going to know that unless we're evaluating it at that time, and what that's going to look like?
So what they've asked for with the conflict of interest form is to have one on file for anyone who's going to do evaluations. And then if it needs to be updated, for instance, you are assigned to an application, a grant application for an organization where your sister works. That's a conflict of interest. So you would need to then file a new form stating, I have this conflict of interest, etc. So they'll want updated forms if there are any new potential update or conflicts of interest. You can also at that point say, I'm sorry, I cannot evaluate this because it is my sister and there is a clear conflict of interest. Does that clear up the question?
Not really. I just want to make sure. So we just fill out a blank one don't check any of the boxes so you guys can have it on file. And as the time arises and we need to update it, then we make sure that you have the updated copy as the conflict occurs. Is that correct?
Yes, that is
Okay, thank
absolutely
you.
correct. Yes,
Mhm.
thank you, Sabrina. Appreciate you asking.
Okay, so we have Karen is next, and then Amy, and then Ron with their hands up.
Thank you.
Hi, Karen.
I really feel like I need to say this
Yes.
because there are, I've been copied on some emails. I've had people reach out to me. I have not done anything wrong. I haven't pretended like I'm the contact for this RFP at all. Haven't given anybody any direction, but there is really a lot of confusion.
Hmm.
Especially, you know, we've been talking in these meetings for months about developing networks, behavioral health recovery networks. So what people have done, and you know, this is the way it works out there, people have gotten together to form networks. And so, and then what they read or learned in the webinar, I didn't listen to the webinar, but apparently the webinar created even more confusion. It basically seems to force people to apply individually and not as part of a network. And so there's mass confusion around that. And the time is clicking away. I actually feel, I physically feel for people who are doing these applications. There have been tears. There have literally been people crying, especially people, what I've heard from community-based organizations who represent exactly the kind of, organizations we want to have in this burn. They're just like, we can't do this. We wanted to be part of a network, and we wanted to tag along with you guys who are filling out the application so that we could be part of it. And, well, I won't go into Eastern Oregon except to say that much of the, especially the higher end services in Eastern Oregon, they don't exist in every county at all. They exist in Pendleton and, some of the other Malheur County, but they have to have this network be regional. It cannot be, it can't be one county does everything. That's not going to work in Eastern Oregon. It's not going to work in Southern Oregon either. I don't know if anybody else is getting comments like this, or people just frantically, they're frantic. I'd say that's a solid assessment of what I'm seeing, is a lot of confusion and people are just frantic. And on top of that, there's all these other RFPs that people are responding to. People are really stretched beyond measure, is what I'm seeing. So I wanted to bring this up. I would love for there to be clarity provided by, the single point of contact based on what we want, we, the council. And I apparently missed something. I attended almost every one of these meetings. When I saw the RFP too, I was just like aghast because I thought we were setting up networks. So anyway, that's my comment.
Got Amy,
I'm
and then
gonna,
Ron. Go ahead.
before we go forward, I'm gonna drop the RFP, the RFGA into the chat, so everyone has the link. And just for clarification, there's an 11-page question and answer document that has a lot of the answers to the questions that you mentioned in it. So that's one place that people can find it. And also, yes, they can reach out to Coral Ford through her email to get answers. And we are creating networks. There's not, in the RFGA, there's not a requirement for people to apply independently. There's an option, but not a requirement.
And that's kind of the thing that people were primarily confused about was that the webinar was presented in such a way that it seemed to limit people's options, where there are actually multiple options available for folks forming burns. And so being able to, for folks, it's primarily in the document, the questions and answers, but it's just that folks need to really understand, they didn't walk away feeling like they had options. They walked away feeling like there were two things: individual applications or a lead fiscal agent with subcontractors. And so it wasn't clear that multiple organizations could come together across county lines and form a burn that served multiple counties. That wasn't clear. It wasn't clear that, I mean, there are a lot of things that weren't clear. One of the things that I'm hearing is that people understand it a little better. They understand what the options are, but the process of collating and combining and putting together the application itself is taking longer than anticipated, based on how we've kind of set this up, that multiple organizations could be part of a single application, as long as they're identifying within the application what their particular service is with their own individual budget. Now that takes some collating and combining, and that's what's taking people time. People understand that they can do it that way, but it's taking people time, and folks have been asking for the potential of an additional week or a few days in order to meet the requirement. Folks are interested and they want to be a part of this, is what I'm hearing, but they understand it a little better, but they need more time. And I've just heard a few days.
I would say that I'm sorry, Ron, your mute went on and I didn't hear.
No, I jumped the line on Amy. I was going back to Amy.
Oh.
Yeah, Amy's next. Do you want to answer that, Angela? And then Amy, thank you for your patience. Amy's next.
Very briefly, I would say that I think we should all sit down and have a feedback session on how this process went once it is complete, so that we can continuously modify it and make it better next time. And I do hear the frustration. I do hear it. And I would love to help clear things up. I am limited by not being able to speak as the sole point of contact. But let's sit down as a group when this is finished and figure out the better way to do it next time.
My turn.
And now Amy, yes, please go ahead.
So I remember when we were all talking and getting all this together and formulating everything, a lot of people were talking about in the council about how there could be more than one burn in a county. There could be networks that came together as a group to apply for the grant, or people could apply individually. Remember us talking about that. I remember us saying that, individual entity that applied for a burn would network out into their community resources that they didn't have as part of being part of the services of the burn. And that, if people wanted to, because there are outlier communities or counties, in the rural areas, that they could come together if they wanted to and create, a network and apply that way. So I remember us all specifically talking about those things in detail. So I hope, and I think a lot of people have missed a lot of our meetings and didn't maybe hear that, but it's definitely in there. So people are absolutely able to apply as a single entity, or as a conglomerate, or however that's going to work, or as an entity that is part of a community network, that serves multiple counties. So I think there's a lot of ways to do it. My best advice would be apply, just do it. And we review it. And we review it with open hearts and open minds for the work that we volunteered to do as a council members. So that would be my encouraging voice to people listening. Don't discount anything, just apply. Put your best foot forward, Do it with your heart and mind open as to what you're trying to provide for your community as it pertains to ballot measure 110, and go for it. Because that's what this is about, is the communities and the people we're going to be serving. So that was where I was with that. And it doesn't have to be one specific, you know, because the counties are larger and some of them are border counties. So, you know, having that ability, you know, for different entities to apply, that was the purpose of this. So don't be discouraged, take heart. That's all.
Thank you, Amy.
Karen has her hand up, and then Ron as well. Karen?
Yeah, I think this is my opinion. I think that a very simple clarification statement coming out from OC&P would go a long way. And if just one statement about, yes, we, you know, networks of multiple entities and multiple counties can apply, because right now people are unclear. They're not clear about that. And if you do that, this is what you have to submit. I mean, one Office of Contracts and Procurement, people that are running this RFP for us, one very clarifying statement like that, I think would go a long way for everybody.
Thank you, Karen.
Ron?
I was just going to reiterate what Amy was saying, and I want to second what Karen was saying, because the council is all along, we've been talking about flexibility, innovation, and collaboration. And so, you know, as we go forward with the evaluation process, when we put on our evaluating hats, that's what we're going to be, that's how we're going to be approaching this. So it may be that the Office of Procurement and Contract has their way of doing things, but the council has its, you know, vision and its, you know, and its purpose. And what the council is going to do is ensure that flexibility, innovation, and collaboration is alive in this process. And so if that means that the OC&P has to, you know, bend to our will, then that's just the case. And so, you know, and that's kind of what we're all kind of saying here is that, you know, we're not trying to funnel everything through a contracts regulations process. We're trying to do this process that's going to result in saving lives and improving conditions for people with substance use. And that's what we're doing. And so I really want to just echo what Amy and Karen were saying.
Are there any other thoughts or questions at this point about specifically the RFGP process?
No, I just had a question. I did have a question. I'm sorry, I just jumped in right away. Who's Reagan?
Reagan, I think, is in contracts.
Okay, I just wanted to make sure. I just seen that she commented and I didn't see her title. Thank you.
Oh, sorry, I wasn't sure if you were talking to me. Yeah, my name is Reagan. I'm with OHA's business operations with the contracts unit. I also formerly worked over at OC&P, so I was simply stating that some of what they do is written in statute. And unlike other laws, procurement can only be done the way the law says it can be done. So within that confines, there may be some limitations. It's been a while since I've read them all or had to follow them all. So I'm not sure what's new or changed. Just wanted to put that out there though.
Thanks, Regan. I think we have Karen and then we have Blue with their hands up.
Yeah, I was going to point to Regan's comment too. I didn't know if there was something we should be mindful about. I know I'm familiar with the contracts and procurement rules and the statutes. Managed 250 contracts for OHA. So what we're talking about here is basically just providing clarity. That's all we're talking about. That's all I'm talking about anyway. I'm not talking about making significant changes. I'm just saying people need clarity, and they really, for their peace of mind and their own mental health, they really do. And I think we owe that to them. So thank you.
I'd like to interject, and maybe Angela, if you think this might be a good idea, or Jessica, Walter, if we maybe put something about this on our website as to where they can look, because the addendum states exactly all of, who is eligible to apply. And if that's within our legal right that we can do that, just to kind of clarify on the website, maybe. I'm just trying to figure out what the action item is to do.
My thought is that I'll do some looking into what is possible at this point, because I know that the question and answer period for the RFGA is closed at this time. So I will do some looking into what can be done to bring any more clarification, and I will let you know what I find out.
Blue has her hand raised. Blue.
Thank you. So I realize that it's probably too late to do anything about this, but I was surprised that that people who are applying as a group were directed that only one organization has to fill out the answers to questions in section 2. And I know our council was really thoughtful with asking a lot of questions to really get at are you working with people that are the most impacted by the war on drugs? How are you going to help people even if they're not ready to stop using drugs? And it seems to me as though a lot of organizations who maybe are not in line with our values can slip in as part of a group, because section 2, people were told only one organization had to reply to those questions. And so I don't know if anybody else was aware of that or thinking that that's how it was going to go when we were working on the questions, but I certainly did not. And so I have that concern, but I think it's probably too late for this round, but I just thought I would bring it up because I was surprised to see the clarification clarified in that way.
So you're saying that in the RFGA, it says that only one organization needs to answer section 2?
That was clarified by Coral Ford, and it's posted in the Q&As. And I don't think Coral has been in a lot of our meetings where we've really been discussing some of these things, but that was how she responded and put it into the Q&A. So that's the direction people have now been given.
Okay. I'll find out. I'll look at the I'll look at the RFGA, and I'll speak with Coral and find out what is being requested.
Thank you.
Thank you, Blue. Just writing a note really quickly. Okay. Are there any other thoughts or questions before we move on to our next discussion?
But yeah, before we move on, I just wanted to circle back to my question around extending the timeline at least a week so that people can compile and collate their applications. And I was wondering if there is a reason we couldn't do that. And are there any kind of timeline repercussions that would be impacted by doing so? Repercussions.
I can answer part of that. I can't answer all of it. In order to answer whether or not it's possible or if there would be any legal barriers, I think I'd have to speak with Coral. If we extend by another week, that would extend, well, I think it depends on how the council would want to do it. Do you want to extend the grant application period for a week and then have the awards land on the same day and the grant agreements rather awarded at the same time?
That would be my suggestion. Just
with a shortening of the evaluation period.
Well, no, I wouldn't say we'd be shortening the evaluation period. We'd just be extending the period for submitting applications. Because right now we're at Wednesday the 1st, and we're talking about having them in by next Thursday the 9th.
Correct. That is the current. That is the current
And
trajectory.
based on the level of consternation and other factors that have been at play, it just seems to me giving an additional week would be fine, and give people an opportunity to continue their submissions. And feel like they have a little, seems like they have, give people a little breathing room, particularly based on the amount of confusion and consternation that has taken place.
I will find out what the steps would be to extension and if it's possible. It may be an order of another addendum. There may be other steps involved, but I'll find out what needs to happen if that is what the council decides they would like to do.
Henry has his hand up. Henry?
Yeah, thanks. I guess I'm starting to get confused also about some of this stuff when when there's a comment about, certain agencies that don't align with the values of OAC, maybe getting some of the being awarded funding. And so I guess that's a confusing thing for me. I'm not sure, maybe Blue, if you want to speak to that, like what would be an agency that would be concerning that would get funding that doesn't align with our values? I think that my thought is that if an agency can provide the services we're asking them to provide, that would be the reason to provide them funding. So I don't know. I guess that's a confusing to me. Thank you.
Is it okay to jump in real quick? Okay. So an example would be an organization that's not transgender inclusive, an organization, and I don't remember all the questions in section 2, but they were slightly different than the ones in section 3, and the ones in section 2 were just a little bit more about overall philosophies. Are you going to kick a person out if they return to use or relapse, versus trying to keep a person engaged and maybe cause a little bit less harm and work on a longer term relationship with somebody, even though maybe they either used once or they're thinking about returning to use. I know those are some of the questions that we have in section 2. And so that would just be, my understanding was that in order for us to evaluate organizations we know nothing about, it would be great to hear all their philosophies around these different things. And in section 3, it goes into specific questions about whatever pot they're applying for, whether it's harm reduction, treatment, peer support, but it's still not capturing a full picture, because some of the questions are in section 2 right now, just about overall inclusivity and how they help people even if maybe they're not ready to stop using drugs. And so at least locally, there are organizations that have historically been abstinence-based that have just cut services off completely for anyone that doesn't pass a urine screen. And so those are the kind of things that I think with Measure 110, we're really trying to say, hey, maybe let's keep these people engaged if we can and still support them in any other way, rather than just telling them they're not welcome here anymore. And so I hope that's helpful.
Yeah, I appreciate that clarification. So maybe, like, for example, there are faith-based organizations in Portland that provide services for the homeless, but they actually, are not, they are not LGBTQ friendly, or maybe they expect people to engage in a way and like have to go to, church or something like that. And you're saying that we want to make sure to like avoid providing what's the word, not payment, but funding for organizations that might discriminate.
Well, I'm just being able to get that overall picture of each organization if they're applying as an entire network where probably one person who's coordinating the application has responded to those questions.
Got it. Yeah, that makes sense. Thanks a lot. I appreciate it.
Thanks, Henry. And Blue, I think we have Karen, followed by Sabrina, Amy, and then Ron. So Karen?
Yeah, I to comment on that last exchange, I think there are ways to make sure that the full network and everybody involved has the same philosophy. I think there's a way to do that. But also there are, people can apply independently. So there are going to be organizations who have the exact philosophy that we want, who will apply for these funds. What I was going to say, the comment I was going to make is I would strongly recommend that we extend the deadline by a week. And if I need to make a motion to that effect, I will do that. But I think it's our decision as a council to do that or not do that. And it would be an addendum. It would be an addendum to the RFP. Even that small change would require an addendum. So that would be my recommendation. Thanks.
That's a motion. I second it.
All right.
I
Well,
would
it
like to,
seems
I would like to
Oh.
still have discussion about it. Sorry, I'm next in the queue, so I'm just going to jump right in.
Please do.
I would be in agreement with what Ron and Karen said, except for if we can still get the money out the door in the same amount of time that we said. And then also I wanted to voice to Blue's concern as well, because that is also a concern of mine. And so if we could address that somehow or get some answers in real time to that, that would be very, very helpful. And so I'm also in agreement to the motion put on the floor by Karen. I just would like the clarity of when the deadline would be.
1 week.
I know that would be 1 week, but the funding will still go out as normal. Is that what I heard?
So the 16th would be the deadline then for the application. And it's up to the council if you want to keep the same date, which was January 10th for the final award letters. And so that would give from the 16th to the 10th to read and review and evaluate the applications and come to a final decision. The final decision would need to be made before the 10th, which I believe is the OAC meeting would be on the 5th of January to meet that deadline. So you would have from the 16th through the 5th to make the decisions. Does that feel feasible to the council?
Okay, I'm jumping in. This
Okay.
is Amy Madrigal. A couple things for Blue and oh my gosh, I can't think of her name, Sabrina. The concerns that you have, we're going to review each application again, just like we did last time. So when those sections come up where they talk about, what is your company view? What is your conglomerate or your network view on a person that relapses or that is struggling? We're going to be able to review their answers to those questions. So I think our screenings are going to help to make sure that the people that we choose to fund are in line with our wishes for Measure 110, right? Funding. So I think that will help a lot, because just like before, if they weren't in alignment, if those businesses, and we'll get a lot more of those applications, they're just not lining up with what we had intended, this to be, then they weren't funded, and they were told why they weren't funded, and to look at that. I mean, I think that that's going to be the same thing. So if that helps you, to kind of remember that we're going to be the ones screening these, I've already filled out my conflict of interest form, and I'm already I hope it got sent off, but I'm going to look again because maybe it didn't. But I want to be perfectly clear that, you know, in the county that I live in, I know there's people applying and I don't want nothing to do with it. So I put it in there, you know, I know these people, I don't want anything to do with it, but God bless them for what they're doing, you know. Just keeping aware of where we're at and what we're evaluating, and when those things come up, it's important. So I also want to say, and then I'll make it quick, is that I agree, if we need to give them another week, give them another week, but that's really going to put a crunch on all of us to have to really bite down and look at all of these applicants, all of them, in an equal way. So if you feel that we can do that ethically, morally, and without, you know, I don't know the word I'm looking for, but I think we'll be able to get through this just fine. You know, I think that that's wonderful. And if there's been some confusion, I think it's going to be great to give people an extra week. And as we've done this already before, where we've evaluated applications, I feel that we do have the capacity to meet this deadline and to help the people that are applying for our funds. So that's it.
Okay, thank you. And just for everyone's information, we've received
Right.
word that it is completely up to the council whether you would extend the deadline. So it sounds like we have a motion on the table. I'll, of course, let you go first, Ron, if you have another comment, but we can do a vote on that.
I think we can call a question. Unless
right.
somebody has other comments.
Do you want to make the motion to move it forward a week and to maintain the 10th? Or do you want to have those be two separate motions? The motion I've heard is to extend it for a week. Do you want to extend it for a week and hold the time? Or do you want to extend it for a week and extend the agreement time for a week?
I'm not the boss. I'm looking for other people to weigh in.
Why
Sorry,
don't we
y'all, just
take the
chimed
first
in.
motion? If we could just take the motion about the extension first. Otherwise, I can retract it, but my motion was that we extend the deadline for the application. And then we can talk about the other date after that.
I second that.
All right, so Karen, you have made a motion to extend the deadline for a week. Sabrina, you have seconded. Thank you. Walter, when you are ready, would you please go through our roster and do a vote?
Yes, I would. All right, let's start at the top. Amy.
Yes.
Okay. Thank you. Blue?
Yes.
Thank you, Blue. Carlos?
Yes.
Thank you, Carlos. Caroline?
Yes.
Thank you, Caroline. Dharma?
Yes.
Thank you, Dharma. Aowen? Somebody can check the chat. Okay. Henry?
Sure.
Okay. Thanks, Henry. Hubert? Okay. Karen?
Yes.
Thank you. Keisha?
Yes.
Aowen voted yes in the chat.
Okay, thank
And yes
you.
for me, Walter.
Okay. All right. Lana? Leticia?
Yes.
Oh, okay. Thank you. Melinda?
Yes.
Morgan?
Yes.
Nicole? Onisha? Ron?
Yes.
Okay. Sabrina?
Yes.
And Zeb?
Yes.
Any nays? We have 15 yes, the vote passes.
All right. I think that there will be a lot of very relieved folks hearing the news of this. So next steps on our end, we will speak with our folks in OCMP and get together an addendum to the Rfga and submit that as soon as possible. So the next question is, if I may, do you want to extend the review time that you will have out a week as well? Or do you want to hold to the same date, which is, my apologies for the car alarm, the same date, which is January 10th?
When were we, Angela, when were we trying to get the funds out to people by?
I'm really sorry about the car alarm.
That's okay.
Here,
I
oh,
mean,
thank goodness.
My best
So
understanding, go ahead, I'm sorry. Go ahead, Andy.
the agreements were set to be determined and the award letters given by the 10th of January, with some flexibility for grant negotiations and the final awards coming sometime in February. We gave some flexibility because of the number, the volume of applications that we're likely to receive.
Right. So if we were just to do an extension for a week, it would allow us a better opportunity and give us more time to thoroughly go through the applications, I feel. Know what other people feel, but I just feel that that would be better and more fair for us to have more time to go through these applications more thoroughly. Because that was part of the issue before. It was such a rush. It made it uncomfortable. So I want to be able to give everybody time. So I would make a motion that we move it to the 16th or 17th of January, from the 10th to the 16th or 17th.
They were trying to speak to anything before Amy put the motion on the table. Just wanted a point of awareness.
I had a little bit of trouble hearing you, Sabrina. I'm sorry.
I said there's some other people in the queue that has their hands raised, and so I don't know if they were going to speak to this before Amy put the motion on the table. So I wanted to make a point of awareness. So there's like 3 people with their hands up, and so I don't know if it has to do with this.
Yep, good catch there, Sabrina. So
Yeah,
we
Walter, are you managing the hand raise function?
yes, I am making sure everybody gets their point across. Ron, you're up. Sabrina.
Go ahead, Sabrina.
I just wanted to make sure that you got called because I know we all had our hands up, and I know that we all want to put the motion on the table.
Right. My question was really, would there be an impact on the funding getting out? And I don't think we know that. Do we know that?
An impact in getting the funding out.
In terms of, I mean, it wouldn't change the flow or the rollout of once we do the evaluations, we do the approval, we have the evaluation, that won't delay the funding getting out any longer by extending the evaluation date.
Well, it would probably extend the entire period. So that would push the funding out a little bit further as well.
But we're only talking about a week or so.
Correct.
Okay, yeah, I'm good with that. Keisha has her hand up.
Yeah, I was just gonna speak to the motion, like, since we're extending the deadline for applications, some people might have some tweaking they need to do. And so that will give us a longer period of time for them to get it back in and get it reviewed. Since we're extending the application time, we should extend the review period.
I think Dr.
So I second Amy's motion, just to throw it out there.
I already seconded
Can I
it.
be recognized for a point of order?
Yeah, Dr. Reginald.
Thank you. There was a motion that was placed on the floor, and then Sabrina asked for questions. When a motion gets made, that's a primary thing. And so, and there has to be time for the motion to either get a second or not. And then if there's no second, then the motion fails. But once a person is recognized to make a motion, that motion has to be heard. And no further discussion happens until the discussion is called for.
We were all,
Yeah, and I
Dr. Reginald,
seconded.
but we were all we were all raising our hands to speak to that before the motion was laid on the table. And so we were waiting our turn before the motion was put on the table. So I was trying to be respectful of that.
But we do have a motion and we do have a second.
Yeah, I had seconded before Sabrina had chimed in, but yeah.
And we're in discussion now. And once discussion ends, then we'll call the question. Is that right, Dr. Richardson? Okay.
Is there any further discussion at this time? Any other questions or discussion about the motion?
Okay, Zeb has his hand up.
Yeah, I just want to make sure that we keep a sense of urgency so the agencies applying for these fundings can start putting the money to use. So I just want to keep that sense of urgency that we have, because I think there's a lot of organizations out there just chomping at the bit to get started. So anyway.
Any further comments at this time? All right, we have a motion from Amy and a second from Keisha to extend the award letter time to be from January 10th to January 17th. Would you please go ahead and take the vote, Walter?
I'd love to. Yep. Let's go. Amy.
Yes.
Hey, thank you, Amy. Blue.
Yes.
Thank you, Blue. Carlos.
Yes.
Thanks, Carlos. Caroline.
Okay, yes.
Hey, thanks, Caroline. Dharma.
Yes.
Okay. Aylwin. Okay. Henry.
Yes.
Okay. Hubert.
Yes.
Thanks, Hubert. Karen.
Yes.
All right. Keisha.
Yes.
Thanks, Keisha and Karen. Oops. Okay. Lana. Leticia.
Yes.
Thank you, Leticia. Melinda. Morgan.
Yes.
Nicole. Onisha. Ron.
Yes.
Sabrina.
Yes.
And Zeb.
Yes.
Thank you.
Walter, Aowen just entered the room.
Okay.
Aowen, we are voting on extending the awards letter time from January 10th to January 17th, if you would like to vote.
I vote yes.
Walter, also Melinda voted yes, but was muted.
Okay. Got you. All right. So we have got 16 yes. The vote passes.
Okay. There we have it. So we are extending the deadline and the award letter time to 1 week out from the previous deadlines. And we will make sure that that addendum is put in the RFGA and that people are notified. Thank you for voting. Are there any other thoughts on the RFGA at this time? before we move to a few other discussions. We may not have time to meet all of our agenda items today, but we should be able to get to the majority. All right. I do see a hand, yes.
Yeah. I wasn't going to make a motion on this if I don't need to, but the clarification statement needs to be made also by OCMP around multi-county and multi-entity applications.
And how to do it. But I don't think we need to vote on that. That's a directive. Right?
I will talk with the folks in OCNP about making sure that that is in an addendum.
Okay, thank you.
All right. So, random brief announcement. The new year is coming, and scheduling will be happening for the new OAC meetings. So there will be a new Zoom link beginning January 5th for the meeting. Just wanted to put it out there to you in case you've been using the same link for every week. There will be a new one. We'll send that out in an invitation shortly. Just wanted to give you that brief piece of information. Next up, we have Sean Mcmahon and Christopher Mcfettridge to discuss reporting with you. So the rules and well, there are a number of places where reporting is required from the burns to the OAC. And so we have been working at the OHA on building a template. Mostly Christopher and Sean have been doing a lot of the legwork. And so we wanted to share a discussion with you on that and get some feedback from you as well on how the reporting might be done. So with that, I will pass on the mic to Sean. Hello, Sean. Thank you for joining today.
Thank you all for having me. Can you hear me all right?
Yes.
Wonderful. All right. I'm going to go ahead and share my screen. Just give me 1 second here. Okay. And can you see the screen?
Yes.
Yes.
Wonderful. Okay, so today I'm going to talk to you all about behavioral health resource network data collection and reporting. In the agenda, there's current data requirements, operational considerations, identified reporting method, needed definitions, frequency of reporting, future measures, and then a recap. To start off, this is just a reminder of the data reporting requirements that are laid out so far. It includes financial details, including as well as client engagement, which includes demographics such as age, race, ethnicity, language, disability, sexual orientation, gender identity, as well as under client engagement, was a call the result of a Class E violation? We need to determine the length of participation as well as client outcomes. Now, with that come operational considerations. These are points that OHA considered when trying to identify a successful method of collecting data within a tight time frame, while making sure that the data collection effort is successful. With that, reporting from entities should be minimally complex. Entities will describe for each burn their reporting using grant numbers. Complexity will increase as new measures are introduced and as improved data collection systems are implemented. Current data collection occurs in aging systems as well as systems do not share data with one another. The process to modernize will kick off in spring and will include providers' feedback to make sure that it's designed to be less burdensome. With that in mind, with the thought process in mind, I should say, of it's not a reasonable use of public funds if we don't design it with the public in mind. There will be some required information that cannot be reported to existing systems, like I stated, such as currently any new requests that the legislator or the council requests, they can't be added into those systems running that specific software language. These issues are being addressed through system modernization, which is targeted for implementation in Q2 2023. More specifically, design will happen this coming spring and will be available for provider use in summer of 2023. To help with reporting, though, data will be able to be connected through the behavioral health data warehouse and start testing the reporting in June of 2022, but would go live this time next year, so that at that time we can make sure that any data is no longer being siloed. And with that, because reporting is required for all burn entities, a single approach to data collection will reduce administrative burden. With that reporting method, the recommendation is for entities to use a reporting template. Some required information cannot be reported in our existing systems, and the template would ensure data quality. Burn entities should feel confident that all service information is being reported, and collection of detailed information supports disaggregated reporting, which will help promote health equity. And the templates will be securely delivered to the state.
I see that we have a question.
Yes.
Ron?
Yeah, you said there was a new database, a new data collection system. Did I hear you right?
Yeah, we're going to be implementing the behavioral health data warehouse through all of the systems that do not speak to each other at this point. It'll be a way to connect all of them together to be able to report in an accurate and timely manner for everybody.
And that includes like MOTS and.
Correct. Yes.
And there's one other that doesn't communicate with MOTS, right?
Yes, there's multiple systems that are going to be going in to the behavioral health data warehouse, MOTS, acute care reporting, problem gambling network, that sort of thing.
Okay, so it's being built. It hasn't been built yet.
No, it has not been built yet.
Okay. Thank you.
All right, so categories of data being reported or to be reported will include entity and provider information, as well as protected client information such as client identity and client demographics. With the protected client information, I would like to emphasize on this one that client identities and demographics are necessary to support measuring things like the average length of participation, but that they will of course be protected given HIPAA and SAMHSA 42 CFR Part 2 where applicable. The next category is the statutory and rule requirements such as ballot measure 110, Senate Bill 755, and the OAR 944, as well as social determinants of health questions, treatment completions, financial summary from the burn entity, and any measures defined by the OAC.
I think a point that we would like to add as well, given the conversation that we at least heard a little bit earlier on, is that our approach right now for data collection is intended to support burn entities reporting their own data. But
Chris, you're breaking up really bad.
Oh, I'm so sorry. Yeah, let me see if I can take care of that. Sean, why don't you go ahead?
It sounds good now.
Now you sound good now.
Now it sounded perfect.
All right, I'll take another shot. And if you can't hear me, we'll have Sean keep going. I don't want to waste any time. What I wanted to share is that the approach for data collection right now is meant to support burn entities reporting their information to the OAC, but that given the conversation before that we heard earlier today, if the OAC has any sort of a different approach for these, the burn entities were described, that we would be flexible, to support that. So I just wanted to share that given the conversation that we'd heard.
Thank you.
I think Karen has her hand up.
Yeah, seeing the term treatment completion is a little bit triggering to me. Our goal is to really not treat addiction like an acute illness. This is a chronic relapsing brain disorder. Some people may want treatment, some people may not. So I would say that maybe, I mean, the language is going to be really important because that's what goes into the system, the business requirements and the language. And I think maybe saying something like care transitions or something like that might be more appropriate. But anyway, I just wanted to point that out, that in the slide, that that's really not the way we're approaching this here. Thanks.
I appreciate that.
Yes, thank you. All right, so for the next slide, we're going to identify further definitions that are needed. The first one would be the SOGI information or sexual orientation or gender identity. That definition would not come from the OAC, as that's done by the Office of Equity and Inclusions. That has not been completed yet because survey standards have not been finalized, and they're going to be going through the rules advisory committees in February and accepting public comment. But once that has been completed, SOGI will be adopted as it matures. Now, when it comes to definitions that would be needed from the OAC, the most important one would be participation. Are clients identified as participating after a single service, or is someone categorized as non-participating after not seeking services for a period, such as moving a client to non-participating category after 60 days? That would be the most important one. And then outcomes. Who describes an outcome impacts both its meaning and how it's collected. So if the outcome is described by the client, gathering information can be extremely challenging. But if it's described by a provider or a burn, how do they know that information, especially for non-participating clients? So with that, there is also one more piece of information that the OAC we would like information from is how often would you like to see new data? There are three options laid out that we have here. Annual, the yearly financial summary will be pretty good on the annual data collection strategy, and it can easily demonstrate year-over-year changes. But there are chances of missing data, more easily impacted by staff turnover and less likely to be detail-oriented. Plus, any report mistakes are a lot more disruptive. With the quarterly, meaningful financial summary still, a higher relevance of data, we have a greater likelihood of detail, and errors are easily corrected with less impact from outliers. Now, it can be a little less relevant information, though, compared to monthly. Monthly, you have a higher relevance of reported data, greater likelihood of detail. Errors can be easily corrected, but it does appear more burdensome to providers. It can offer incomplete financial summaries, and participation episodes may not be complete with those. Now, considerations, oh, sorry. I will go back to this, and Karen has her hand up.
I think, were you asking a question? Because I was going to respond to your question.
Yes, it would be how frequently does the council expect to receive new data from entities?
I don't speak for the whole council unless we all take a vote, but my I would say quarterly from my perspective.
Okay. Thank you.
Yeah,
now,
just as a point of process, were you wanting feedback from the council today on these questions?
If you'd like to give feedback, that would be preferable for that, but we can do that later on. I believe towards the end, there's a recap, and if you would like to make any decisions, that would be great.
Yeah, the council, Jim, tends to engage in robust conversations around these sorts of things, so I just wanted to.
And it is appreciated.
Okay.
And considerations for future measures, though. Consistent reporting among burn entities will support performance evaluation.
I think we have another question, Sean.
Oh, I'm sorry, Caroline.
Yes, you must forgive me. I'm on the governor's summit behind me, so I'm multitasking. So I'm trying to focus on one or the other. But going back to your slide, the one before, yes, that one. I think we this might be something that we might have to discuss later on. For a brand new program, there's not going to be very much to share in terms of demonstrating, I guess, actual numbers. There has to be a way to do a startup. I'm almost wondering if we're leaning towards the first year, like a half year, just to measure where folks are at. Because with so many awards we think we're going to be giving out, we're going to have some folks who are ready, they're going to be shovel ready to just take in these dollars and could easily just slide into the new data system. And there's going to be others who are just going to be putting their foundation together, you know, for their plan, and they're not going to have very much to report. So I think this could be a goal for the future, but I think we need to be, we can't, I just say one size fits all for right now. So I'm looking at, and you don't have a half year on there, but that's just something that I'm throwing out there. I don't need a response right now.
Thank you.
So for clarity, but we're going to fund the projects in February of 2022. You're saying this data system won't be in place until 2023, correct?
Correct. The modernization for the existing systems, yes. And this would be an interim option until those are updated.
Okay, so the projects will be running with some other kind of way to collect data before this new thing goes into effect.
Yes.
Is this cloud-based?
Christopher, you want to speak to that?
Karen, is just to make sure I understand your question.
You just went static again.
Let's see what's going on.
I guess the reason for my question, I'll go there first, is I've been involved in some really painful data system development at OHA. And it seems like you have used programming that kind of goes out of date quickly. And I just want to make sure whatever we're putting together, you are putting together, is not going to do that, that it'll be, you know, easily amended and changed. And, you know, I don't know. I'm not a technical person. I do not have that training. But anyway, that's my reason for the question.
Yeah, let me try to respond. Can you hear me now?
Mm-hmm.
Okay, perfect. Sorry for that. So the future state, the modernization that Sean's been speaking to, will be cloud-based technologies that will have the attributes that you've described. It'll be dynamic, it'll be flexible. The interim solution that he's also described is this period of reporting is meant to fill that small gap before the modernization has been completed.
Chris, you might want to repeat that. You were a little staticky on that. Can you repeat what you just said?
Yeah, happy to give it a shot. Sorry, everybody.
Yeah, when you lean forward, it seems better when you lean forward.
All right, well, I will maintain a forward position here. To respond again, the modernization efforts that Sean are describing will be cloud-based. The interim solution that he is describing and the data elements that he's described as needing to be collected are meant to occur between February and the implementation of that modern system. So the templates that he's describing are sort of a little bit more of the traditional method for data collection that the agency has engaged in. Does that speak to your question, Karen?
Yeah, and the interim solution is not manual.
Is not manual. It is the intent is to have burn entities submit batches of files. So batched file.
So they'll
describing.
upload their files in some system.
Yeah.
Okay.
They'll upload. They'll transmit templates that are filled with the information.
Okay. And then maybe later in your presentation, if you get, I don't know if you're going to get there, but I'm also curious what, just about the priority. I know OIS is a shared service and there's a bunch of different things on the plate. I just want to make sure this is a priority or know what priority this is. But you don't have to talk about that now. If you just maybe hit on that later. Thanks.
So next slide here, considerations for future measures. Consistent reporting among burn entities will support performance evaluation. OHA can support the OAC identifying barriers to data availability and cost for data collection, such as administrative burden, OHA support and assistance, and then the runway between data collection and meaningful reporting. So the next question that we have is, how does the OAC intend to measure success? Are there things the OAC would like to measure across all burn entities and service types that aren't described within ballot measure 110 or Senate Bill 755? And within the next 6 months, we would like to come back and have a detailed discussion on how the OAC would like to measure success on different service types. So with a quick recap, talked about described reporting requirements and current context for data collection, reviewed the proposed reporting method and reviewed types of data to be reported. System modernization again is to start in summer of 2023 for use. Now, the key decision points that we've identified is identifying the reporting frequency, defining participation. Those two would be needed a little sooner than the outcomes because that's expected to be done over time. And so, yeah, with that, if there's any questions outside of the council here, Christopher Mcfettridge and I are easily accessible and our emails are listed and you can email us at any time.
Karen, I want to return to the question that you'd asked. I guess I'll pause to see whether folks can hear me.
Yes.
All right. I can assure you that the system modernization that we're describing, in particular, the behavioral health data warehouse, which is something that Sean spoke about, as well as the ultimate replacement of a data collection system that is currently described as the measures and outcomes tracking system, are absolutely a priority. We have project teams devoted to them within the Office of Information Services. They have also been funded by way of advanced planning documents with CMS, which I mentioned to demonstrate that there's a certain level of accountability that we have not only to our partners within the state, but to our partners within the federal government as well.
Thanks, Christopher.
Yeah.
Ron?
I just was curious as to whether or not you guys, Christopher and Sean, if you're involved in evaluation and data that Julia Dilley is working with and her team that she's put together through OHA and Measure 110 to do metrics and evaluations. Are you participating in that? Are you part of that?
I have been in the conversations with Julia Dilley and almost all of the meetings that she's given.
Okay, good. I just wasn't sure if you guys were part of that. It's great. I'm glad you're there. So I think we're going to have to probably take these questions, off, not offline, but I don't think we're going to be able to give you the answers right this minute. We're going to probably need to have a discussion and talk about it, and then we'll be able to get back to you through Angela or something like that. How about that?
That works. Thank you.
Angela, does that work for you?
That is completely fine with me, yes. Would you like to have a discussion at this time about these points of information? We have a half an hour left, and we can delay the other agenda items if you would like to discuss this now. Or we can move into, I think we have time for one more of our agenda items today.
Would you like me to stop sharing?
Yeah, that'd be good.
Sure. Thank you.
You're welcome.
And then we have Karen with her hand up and Amelia.
This is really, really important. Data collection and monitoring the data is going to be extremely important. Like I think I've mentioned before, which everybody probably already knows, there are people out there who do not like this. They do not like what we're doing. They do not like what Oregon is doing. And having the data that shows people how this is working, that it's working, is going to be really important. And I think that it's so important that I believe we should have a business requirements session with the council and with you, Sean, and Christopher, whoever else is going to be involved in this, from OHA and OIS, because I really, like I said, I've been involved in these things before with OHA, and it was excruciating. And MOTS has never worked like we wanted it to. And the result of that, in fact, it was probably one of my pain points at OHA, one of my biggest pain points. Because when legislators or people, advocates, lobbyists would ask me, the media would ask me for information, I didn't have it. I didn't have the data. I couldn't get it. I knew some great things were happening out there. I knew that providers were doing great work and people were, getting better or whatever, lives were being saved, but I didn't have the data. Couldn't get it. So this is probably the most important thing, I think, that we really need to focus on, because I don't want anybody taking pot shots against us as a council, against what we're trying to do here, because that will happen if we're not able to tell the story with the data. So that's my comment.
Amelia?
Okay. So I just wanted to remind people that the rest of the agenda has the media plan conversation, application screening update, and lastly closing. But I did want to ask Karen, I'm taking notes. So I wanted to ask Karen what the addendum language was. I had written down OCMP needs to clarify on multi-county and multi-entity, and I didn't finish. So what was the exact language?
Yeah, it's just basically the application that needs to get submitted. What does it have to include if it's a multi-county or a multi-entity application? That's what people are swirling about. There's a lot of confusion around that. And based on what was said in the webinar, it sounded, people got the impression that they couldn't submit a multi-county application or a multi-entity application. But then it was just said in this meeting today, earlier, that the written Q&A says you can, the RFP says you can. So there's just a lot of confusion around that. So it's simply, if you're going to submit a multi-county application, what needs to be included in that application? What specifically needs to be included in that application?
Okay, I wrote that. And I know in speaking with Sean and Chris, they did have two questions that they, I think, wanted to have answers for regarding the reporting frequency, and then the other was defining certain measures or outcomes. But I know that the media plan, that's something that we were going to talk about, and it was something important to bring up. If y'all wanted to, how you wanted to go on about carrying on the conversation.
So on the agenda, we do have the discussion of the media plan, and I believe that we'll have time to complete that if we wanted to start that conversation now. but there are the questions of reporting also to discuss. We can move that to a future meeting.
Yeah, I
and
would,
have
sug-
that
I would
conversation.
definitely suggest, I think there's I think Karen's right. The data conversation is a bigger conversation than I think, we're ready to have today. And so I would recommend that we move to the media plan and then maybe start the next meeting with the data questions.
All right, we can do that. All right, well, any other thoughts or comments?
Sabrina, is that all right with you? Keisha? I think there's somewhere.
I didn't hear you.
To put have a full conversation about data and evaluation, data and reporting, have a full conversation starting the next meeting, but go ahead and do the media plan conversation now.
Yep, that sounds good to me.
Okay. I think Sabrina's busy, but so let's go ahead with the media plan. Onelia, sorry.
Was that me to present?
Go ahead, yes, please.
Okay, hi everyone. So
there's been conversation regarding media. There's been conversations between council members and staff. And so that culminated in a presentation today between Morgan and Onelia. Will be talking to our proposed media plan.
yeah, so I'll go ahead. Do you want me to pull up the media plan document that I sent you, Morgan, and then you can take the floor?
Yeah, that would be great. So just for context, I work in journalism as an editor. Like that's what pays my bills. I don't get paid to be in this meetings through work. I do a lot of drug policy and harm reduction journalism, but I really have started to see things through like a media lens. A lot of my work at Northeastern University was like doing media analysis of like misinformation, especially as it relates to drug and drug use. And I just saw a sort of perfect storm convergence of factors with Measure 110 because there is not a cohesive strategy. So I met with Onelia and I just shared some ideas with me. She had some wonderful ideas and then she did the work and came up with this media plan we're about to see.
Sorry, I was typing. I appreciate y'all saying my name right. Okay, let me share my screen. Let's see. All right, Morgan, go ahead.
Okay.
Oh, wait.
So, it's 2021, so social media is a very effective way to disseminate information as long as it's coming from a trusted source. That also counters the fact that a lot of misinformation also comes from social media. So having a well-established, legitimate presence will benefit us. And so talking about the services that we are funding, just like where we're at in the process, I think that would all do a lot of good. My aunt called me yesterday and was like, well, where's the money actually going? What are you actually doing? And I was like, whoa. And so even people really close to me in my life are confused about what we've been doing. And I think, Facebook page, each of the different socials captures a different demographic. I hadn't thought of the Reddit question and answer, but I have seen that done very successfully from other organizations. So that is great. And then, the OHA Measure 110 website, and this is so critical, where there's just a repository, a URL that anyone can go to and has all the relevant information clearly stated, including, grantees. And so I saw there was a piece that was pretty widely syndicated that quoted you, Keisha, and that was great. That was the first time I saw like a fairly comprehensive, this is what the OAC is really doing. And I saw that in the Portland Tribune and in the Oregonian. So that really made me happy to see. And we could see more of those about what we are doing, not what's not being done, but what we are doing. If we just had a little bit more collaborative, a data repository, and also sort of publishing, like we need to probably form a media plan subcommittee, action item number 1, and decide what our goals are. Oh, you didn't see that, Kate? I saw that all over the place, but I'm I read too much news, constantly reading news. And that made me super happy to see. I want more of that. So I don't know how those journalists found you to reach out to you or exactly how that happened, Keisha, but if we have like a plan, it can happen more often. So establish a media plan subcommittee. Within that, just define what our values are that we want to continuously convey to media, what things we want to be readily available. And then also probably writing an informative Measure 110 piece that's going to include some outcomes of funding that we have already provided. And the timeline of this could be discussed in the subcommittee and then voted on by the full council. If we want to write that collaboratively, if several different council members, I know both Amy and Karen, when I brought this up the first time, had wanted to be involved. I'm a writer by trade, so I would love to support anyone in writing or editing that piece and getting it placed probably in the Oregonian or a outlet with a wide readership, just to really get our message across. And I've had pretty good luck placing things that I've written in the Oregonian. So I think that we could really do this. Actually, they just wrote me on Friday asking me to write about something else. And so I could either do that, or we could like emphasize really this and all come together and just, but like, not an opinion, just fairly explanatory. This is what we're doing. These are our values. This is what we're going to do in the future. Just so people know what we're up to. And, you know, a whole bunch of funding is about to go out with the burns. And so this is the time that we really need to be controlling the narrative and telling people what we're up to.
We have Keisha with her hand up, and then Blue.
Yeah, I was just gonna say that that request actually went to, I think, OHA and Angela, and she reached out to the tri-chairs, and we made a decision on who would write the quote. So that actually came to OHA. I don't know how it went to the other outlets, but that's how that happened.
Yeah, that's thank you, OHA, for getting council members' voice included and forwarding that to our tri-chairs. I really appreciated that piece of positive news. And that doesn't have to be like an outlier occurrence. The more we do a coordinated media plan, have social media, have a website, then it's going to really start to become a regular thing.
I think Blue has a question.
Yeah, I just wanted to also thank you, Morgan, for getting this set up and, you know, coming up with a plan, because I also feel like if we all had, for example, talking points that were similar and really clear to understand, so that any council member that's engaging in conversation with somebody would be able to reference those, just make it a little bit easier. And the only thing I didn't see on there that I would just suggest is, most of the people I work with are really concerned about what a screening is. And I know that on some platforms, you're limited with how long a video can be. So maybe adding YouTube, if somebody could see and hear all the questions of a screening, I think it would take away a lot of their anxiety and learning that, you know, we're not going to tell the police what your answers are, for example. You know, just, I would really like to see the number of screenings increase, even if people have other charges. It's just a way to sort of expunge your records on the front end rather than the back end, and get that taken care of. So that would be the only thing that I would suggest adding, but it looks really great.
I think that's a great idea. A short video, like TikTok style video, would really be able to get the point across really quick and perhaps make people feel safer calling the number, getting the screening. That's going to take some budget. So I would like to ask OHA how we could get some funding here. Not very much. I'm talking like a 90-second video plus, but there will be some expense here if we wanted to have a very comprehensive plan that would reach the most people and be most impactful. Dharma?
Yeah, and in line with that, I think it's really important that we develop some media that we can share with Burns. to help like demystify what they're doing to resistant organizations in smaller communities, especially where there's like maybe smaller local law enforcement isn't on board, other treatment providers that are not like, you know, part of the burn that are resistant. I think it'd be really good to have consistent and clear, you know, like public communications that we can provide to burns to help, you know, explain what we're doing, explain what the differences are in the laws now. Because at a smaller town level, I'm seeing a lot of resistance from peripheral social service organizations who won't have anything to do with the burns. But I think that we need consistent ways to communicate to community members who might be concerned or resistant to help get them on board with what we're doing.
I think that's a great idea. That's something I wouldn't have thought of being here in the urban environment in Portland. I'm so glad that we have this diversity of voices and thought. At this point, I would like to make a motion to form a media subcommittee.
I second the motion.
Can we do a voice vote, perhaps?
So we have a motion, we have a second. Any discussion? No discussion. Let's call the roll.
Yes.
I didn't hear the question. I mean, the motion.
Oh, my bad. There you go.
Motion to form a media subcommittee.
Any other discussion? Any other questions? Do we have quorum? Yes, we do have quorum. Oops. Did somebody have something else to say?
Sorry, it was me. I was
Oh,
just
that's
voting
okay.
yes.
Oh, we have quorum. So do you guys want to do a roll vote, or you guys want to just do the other vote? All in favor, say aye.
Aye.
Aye. All
Aye.
opposed, say nay. The ayes have it.
Very.
Yes. Good job, Ron.
Thank you so much, everyone. So Angela, how would you like to handle inquiries for who would like to participate on this particular subcommittee? Muted.
Thank you for that. Why don't we let's have this process. I will send an email out to the entire council with a reminder of what you are volunteering for and a request to send me your willingness and interest. When would you like to begin having the meetings? I could also send out a doodle schedule. We could start this month. We could wait until the beginning of 2022. I'm seeing lots of different head nods. What do you all think would be ideal with the fact that we have this RFGA to evaluate as well? Just want to make sure you have enough time for your holiday activities.
I just want to chime in. Can I chime in? This is Amy Madrigal. Why don't we start it in January after we've had a chance to review all these applications and get this stuff done?
I totally understand that thought, because right now the time ask of us on this RFGA is really high. And because we're doing that, it's a really good time to start to have some comprehensive plan a little bit ahead. And I can take point on this. I can take lead and draft things. Like I am dedicated to this particular mission and will commit my time to it. So I need to know what people want me to do.
Yeah. Okay.
Thank you, Morgan. So I'll send out an email to everyone with Morgan CC'd and ask for responses so that we can form a committee. I'll gather that information until, let's say, Monday of next week. So if you can get me an email back by Monday of next week, then we can start scheduling out the subcommittees. Does that sound all right to everyone? Okay. So I will send an email this evening with that request.
Karen has her hand up.
I'm just, go ahead.
What I was
Go
gonna
ahead.
say is, based on the timing of our RFP work, I do agree that there's probably some staging that should happen, like the talking points, I think would be important to have first for everyone. Because that's, I think that's gonna be low hanging fruit, and it could help all of us even to talk, to know what to say until the decision's made and people are getting their award letters and things like that. I also just want to say that I think we should be cognizant that not everybody speaks English in Oregon. So, we need to think about that and make sure we have things translated. Thanks.
Yeah, that's a great point. So I speak fluent Spanish and can write in Spanish. So I've got Spanish covered. We have a few other primary languages that will need to be translated into. So that's another thing that might require financial resources support on behalf of OHA.
Yeah, I think OHA has a huge translation machine, doesn't it?
We have a company that we work with, or several companies, probably contractors that we work with to do translation services. Yes.
Just one more comment. Were you going to talk about the Friday evaluation training?
I believe I mentioned that at the beginning, but I am happy to
Yeah,
reiterate.
I think you should. If you could reiterate that, not jump ahead of Henry. He has his hand up.
I'll make my comment after Henry.
Yeah, I just want to make sure we're using, medically accurate terminology when we're translating, and this is not, I don't know, this is not in any way a comment about your skills, Morgan, as a translator or, speaker of Spanish. And, I think it's really, I just want to make sure that we're utilizing translators when necessary or when appropriate, because, I have a undergraduate degree in Spanish, and I speak to Spanish, native Spanish speakers all the time in a clinical setting, and I'm not a medical translator. So, I want to make sure that we're, I don't know however else to articulate that. I appreciate your desire to want to translate and be helpful in that way.
Yeah, so I did work as a medical interpreter for a while, and I stopped because sometimes I would find words that I didn't know, and it made me super uncomfortable because no matter how many years I've been speaking Spanish, I will never be a native speaker. And so, yeah, using professional translations is fine. The one thing I was thinking of is sometimes spoken word just more effectively conveys the point. So do we have any native Spanish speakers on the council who can talk like in the videos in Spanish? That would be super beneficial too, because we will have, if we're having some videos, it'll not just be like written translations. We'll require people speaking.
I think we do, but they're not identifying themselves, or maybe they're not here right now.
Yeah, this is Leticia. I can fluently speak Spanish.
All right. Well, that's great. Morgan will be looking you up then.
Great.
Any other questions? And thank you so much, Morgan, for bringing this up and taking the initiative to start a subcommittee to make this happen. Very much appreciate it. Any other thoughts on the media plan? We have just a few minutes left. Not enough time to complete our agenda for today, so we'll move the discussion on fraud, waste, and abuse to next week after the discussion of reporting, which I believe is the first order of business next week.
Evaluation training?
Yes, thank you, Ron. So Friday at 11 o'clock in the morning, we are holding a meeting. You've all been invited to it. A calendar invitation has been sent. So we'll be meeting to discuss the evaluation of the RFGA We'll go through the RFGA evaluation rubric and explain in detail what we are looking for, what detail needs to be included, and how to go about scoring each of the applications. So that will be myself and the Measure 110 team, and also we will have Coral Ford assisting us with the process as well. So please do join us on Friday. We're going to record the meeting. So if you're not able to attend, we can get you a copy of the meeting so that you can have the same review as anyone else.
Thank you.
All right.
Sabrina?
If there are not,
Okay, yeah, thank you. I would just thank you, Angela, and thank you, everybody, and thank you all the presenters for today. And I would like to thank everybody for this transition of how to function and flow well with raising our hands and then chiming in and all that kind of stuff without Roberta here to lead us. So even though it's a process, I appreciate all of you guys and all of your input. Karen does have her hand up. I don't, if you'd like to speak really quick, Karen?
Yeah, my comment is just gratitude as well. I want to thank everyone for the conversation we had about the RFP. I feel relief for people actually, physically and mentally. And so I just want to thank everyone for having that conversation and doing the voting that we did around that. So thank you so much.
Karen.
And if nobody has anything else to add, I think we can actually be done a couple minutes early today. Okay, thank you.
Meeting is
Thank you,
adjourned.
everyone.
Thank you all so much. See you next week, and I'll be sending you lots of emails.
I just want everybody to know I took all the media stuff that was dropped in the comments and put it into a document. So I'm already keeping track of your feedback.
Delightful. Thank you, Morgan.
Thanks, Morgan.
Thank you, Angela,
care.
Morgan, and everyone. Have a blessed day.
Thank you. Thank you, folks.
Thank you, Amy.
Take care.
Bye.
Bye, Dharma.
We should be good. It was live streaming, so we should be good with not needing the recording.
Yeah, great job.